Have you experienced any fevers, chills, night sweats, fatigue, changes in weight, headache, dizziness, fainting, seizures, numbness, or weakness, sore throat, cough, runny nose, chest pain, shortness of breath, palpitations, abdominal pain, nausea, vomiting, constipation, diarrhea, pain with urination, increased frequency of urination, blood in the urine, blood in the stool, joint pain, swelling, or rash? So that is the review of systems. It's this barrage of questions that doctors are trained to ask at the end of the medical interview. Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today I want to talk about the review of systems. So it seems really crazy. It's a lot of questions that might get thrown your way during your visit to your doctor, but it actually exists for a good reason. And that reason is to make sure that nothing is missed during the medical interview. I'll give you an example. One time I had a patient who was experiencing chest pain. So of course, anytime you hear the word chest and pain together, you're worried about a heart attack. So I conducted the medical interview, asked a lot of questions really focusing on the heart. I asked things like, what is the character of the pain? Is it like a pressure sensation, like an elephant sitting on your chest? Does it radiate to the shoulder or the jaw? Does the pain come on with exertion? Do you have any history of heart disease in the family? Anyone with a heart attack with your mom or dad or siblings? So all these questions focusing mostly on the heart because that's the organ you think of when you hear about chest pain. But at the end of the interview, I did do a review of systems. Now, I didn't do it all crazy like I did at the beginning of this video. Hopefully, no doctor will do it in that really fast barrage of questions. That would be really bad bedside manner. But I did ask a series of questions, mostly going head to toe, looking for anything that I might have missed in the interview. And sure enough, the patient did say that when I asked about joint pain, that, he's been having arthritis in his knees and actually takes ibuprofen more or less around the clock and has been doing so for several weeks. So this was something that I wouldn't have really thought to ask about when talking just about the chest pain, just about the main symptom. You're not going to ask about knee pain necessarily, but once that information was brought to my attention, it became clear that I needed to expand the differential diagnosis, think about other things that could cause chest pain, in particular peptic ulcer disease or stomach ulcers, which you can get as a side effect of NSAID medications like ibuprofen, which this patient was taking for knee pain. All of that I wouldn't have known to focus on had it not been for those review of systems questions bringing it to my attention. So that's an example of how these questions can provide valuable information to help your doctor form a diagnosis. But one thing to keep in mind is that these questions are really designed more as a safety net to make sure that nothing is missed during the medical interview. Ideally, your doctor really shouldn't start the interview with just a barrage of questions like this. What I like to do is first I just ask the patient to explain in his or her own words what's been going on, and I just sit back and listen. I don't start with this 21 questions kind of thing. That would be really bad bedside manner. In fact, I think some doctors might not even ask the questions. They might have you do a survey which asks about any other symptoms, but no matter how it's done, the review of systems can provide useful information. Okay, thanks for tuning into this video. If you like medical or medical adjacent content like this, feel free to hit the subscribe button there or check out another video right here, and I'll see you guys next time.